Hello, I am Dr. Rammohan Reddy. I work as an orthopedic consultant at Yashoda Hospital's high-tech division. Today, I would like to talk to you about the role of robotics in knee replacements. Traditionally, we have been using standard manual instrumentation. Over the last decade or so, new technology has come into the healthcare system. It started off with computer navigation and then patient-specific instrumentation, and now robotics. Let me explain to you how the robotics works. In knee replacements, there are different types of robotic systems which have been installed or invented by the companies. Now, each company has got a unique robotic system. With the robotic system, the surgeon has to use the implants only manufactured by that company, which means the robotic is implant specific. If a surgeon uses a robotic system of say A company, he cannot use the implants used by another company. Now, what kind of robotics are there in the industry? Number one is where the surgeon controls the robotic equipment, how he takes the landmarks, and finally what kind of guidance the robotic system gives to the surgeon to get the best outcome for the patients. This robotic system is the best for us because the surgeon knows when to control, how to change the system, and what landmarks are needed and what kind of bony cuts are to be made. The second robotic system is where there is a need for CT scans. This robotic system is more laborious. The CT scans have to be taken pre-operatively, and then it has to be put into the system so that the robotics equipment gives the landmarks and the necessary cuts that has to be made. Here as well the surgeon controls the robotic system. Again, the CT scan based robotic system can use the implants manufactured only by that company which uses that particular robotics. The third robotic system is where the surgeon feeds in the landmarks and the robotic arm does the cuts. Here one has to be very careful. If the surgeon puts in wrong landmarks, then the robotic arm will use that landmark and can do wrong bony cuts. There can be injuries to the blood vessels, ligaments and nerves. The surgeon cannot change the landmarks once the input has been given to the robotics, which means robotics overrides the surgeon. This is one of the few robotics where one has to be very careful. Again, the implants have to be used only manufactured by that company. Of all the three robotic systems, the first robotic system where the surgeon uses the landmarks given by the robotic equipment is probably the most useful one. Along with this system, the implants which are manufactured by the company are very good. For example, the material. Almost all companies have got chromium cobalt steel implants, whereas one particular company where the robotic system is controlled by the surgeon uses or manufactures ceramic or what we call oxynium implants. Oxynium material has got a good outcome for over 25 to 30 years. Secondly, in the oxynium implants, the leg bone component is designed specifically for right side as well as for left side. This implant design is not there in other companies. So the patient has to understand it is not just the robotics, but it is also the implants, the materials and the design which matters a lot for the best outcome. I have not only been trained as a surgeon but also as an engineer. Having studied the metallurgy, the implants, the design and materials, I feel that patient specific or the joint specific, whether it's a right side or the left side, these unique designs and the ceramic material with the most advanced robotic equipment combination gives the best outcome to the patients. Thank you.